Hello, everyone. My name is Katie Schubert, and I would like to propose my study topic of health and wellness-based coaching for critical care nurses in an effort to reduce burnout syndrome. All right, so my question is, does one-on-one health and wellness-based coaching reduce burnout syndrome in critical care nurses? And I am the principal investigator, Catherine Schubert. So my committee will consist of Dr. Jessica Matthews, who has so graciously agreed to be my advisor on this project, and then also Marla Poston, who is the Director of Nursing at Sharp Coronado Hospital, has agreed to be a facilitator of this project as well, and has so graciously agreed to provide space for the health and wellness-based coaching sessions to take place. So the performance site will mostly be via live video chats and calls, FaceTime and Zooms, just purely based on the need for social distancing. Some of the research could be obtained within Sharp Coronado Hospital and Sharp Grossmont Hospitals here in San Diego County, and that is based on the nurses' availability and then also the need for social distancing. So, what is the problem? The job of a healthcare provider can be very rewarding at times, but it can also be especially exhausting during this time of a global pandemic. Burnout syndrome in critical care nurses has been recognized as endemic, and this was present in the literature even prior to the outbreak of COVID-19. So what is being done to mitigate this issue? Limited research has been done to present solutions to this issue, even though it was recognized as a problem. The majority of studies regarding burnout syndrome were performed prior to COVID-19, but unfortunately, emerging research from the coronavirus pandemic is showing that more than 75% of critical care nurses are experiencing symptoms of burnout. So, our question once again, will one-on-one health and wellness-based coaching decrease burnout syndrome in critical care nurses? So the significance of this study, health and wellness-based coaching has been brought up as a topic of interest and a potential solution to reducing levels of burnout and moral distress in ICU RNs. There have been other smaller unit-based studies that have been done, but most of them have focused on team building and boosting overall morale and not focusing on the individual nurse themselves in an effort to reduce burnout syndrome. So the qualifications that I have to run this study, I am a registered nurse. I do have my bachelor's degree of science in nursing. I have been working at the bedside for 8 years, all in ICU. I went right into ICU as a new graduate nurse. I am currently working on the front lines of the coronavirus pandemic. I have access to the nurses, the subjects, and the space to perform the investigation. I also have a deep interest in the mental and spiritual well-being of both my patients and my coworkers. And I have been my own guinea pig, if you will, since first stepping into the critical care environment. I recognized right away the need to establish healthy self-care practices. And so I would love to see if health and wellness-based coaching is indeed a solution to reducing burnout syndrome in my peers. So the resources that I would need for this project is really not much at all. We would each need, myself and the nurse that I'm working with, a notebook or paper and a pen. I will need copies of the assessment tools that I'll be using, which include the Maslow Burnout Inventory and the Professional Quality of Life scales, phones and computers for our video conference calls, and then also space in the hospital for the in-person sessions. So the specific aim of my study is to determine whether or not one-on-one intervention using the health and wellness-based coaching will reduce burnout syndrome in critical care nurses. My hypothesis is that the health and wellness-based coaching will reduce burnout syndrome in ICU nurses, and could potentially be a solution to mitigating this issue within this group of healthcare professionals. So in reviewing the literature, as I said before, there have been various studies that have focused more on unit-based issues. Mindfulness-based stress reduction practices have been implemented. Nurse-to-nurse caring models have been used, which involves nurses boosting each other up. And also, there's a lot of literature, particularly in the nursing literature space, that is bringing better leadership to the forefront in order to reduce moral distress within a unit. And all of these studies have shown improvements in morale and in reducing burnout. However, they haven't focused on the individual nurse. They've been focusing more more overall, like team related issues. So the practice of health and wellness-based coaching has made appearances in the literature as being a possible solution to mitigating burnout syndrome within critical care nurses. And I even found some literature that supported nurses becoming coaches and then coaching fellow nurses. So this could increase the resiliency and of the nurses in the ICU, and also allow them to perform better in the workplace as leaders and as team players. So a little bit more literature review that I thought was worth bringing up in our current times. In a cross-sectional study of data from COVID-19 and previous pandemics, Emmanuel Peretti and his colleagues found that healthcare providers that provided frontline care in these large infectious outbreaks continue to experience symptoms of anxiety, insomnia, depression, and even PTSD years after the resolution of the pandemic. So I thought this was really important to bring up because now more than ever, we need a solution to reducing moral distress and burnout within our healthcare professional population. So critical care nurses in particular are vulnerable to developing burnout syndrome. The nature of the job itself is a repeated exposure to excessive demands made on them through their patients' family, physicians, and even the hospital groups that they work for. It's really important that we find ways to boost their internal strength, that resiliency I spoke about before, and and maintain their mental health in order for them to continue to care for the critically ill. So the design of my research study, I'd like to have at least 20 ICU nurses participate. All will be volunteers who have verbally expressed symptoms of burnout syndrome. Each of the RNs will be randomly assigned to either the study or control group. I'd like to divide it in half. Each volunteer will be administered the MBI and the PRO-QOL assessments prior to beginning the study, and then we'll immediately dive into week 1 with the study group of the weekly one-on-one health and wellness-based coaching sessions that will continue on for 8 consecutive weeks. And the homework assignments will also start that first week as well. And the weekly homework assignments will consist of activities surrounding what has been deemed worthy of focus, what the client or nurse values. And that homework might evolve week to week, but it will always be something that's agreed upon between the nurse that I'm working with and myself as the weekly homework assignment in order to achieve their goal. So the participants in the study will all be licensed RNs, licensed in the state of California. They'll all be working in the ICU environment, and they'll all have at least 1 year of bedside nursing experience in intensive care. They'll all be between the ages of 22 and 65, and male or female, it doesn't matter. As I said before, they'll all be screened for verbal self-reported signs of burnout syndrome. And no status such as marital status, whether or not they have children, level of nursing education will exclude them. They will be surveyed, but they will not be excluded. So materials needed for this study, I will need access to the Maslach Burnout Inventory Scale as well as the Professional Quality of Life Scale. As I said before, each of us will need a notebook, access to phones or computers for our video sessions. And then I'm estimating about maybe $20 to $30 for printed materials. That is if I'm actually physically handing the inventory scales to the nurse to fill out. Otherwise, I could email them and they could complete those via email. So independent variables would be the ICU nurse, and our coaching sessions as well as the homework will be carried out away from the bedside. The dependent variables will be the results of the assessment post-intervention. And then also I'd like to have the nurse in the study group, the individual nurses keep progress of their of how they're feeling, and hopefully they themselves will be able to see themselves moving towards reduced symptoms of burnout and moral distress. So the study protocol will be obtaining the volunteers and screening them verbally for the symptoms of burnout syndrome, randomly assigning the RNs to the study and control group, half and half. As I said before, I'd like to have at least 20. Administer the assessments, begin the one-on-one coaching sessions with the study group participants, and then that's when the homework will start as well. They're in week 1. 8 weeks of once weekly coaching sessions are provided, and the discussed upon homework will be completed. And at the end of the 8 weeks, the MBI and the ProQOL will be re-administered. The expected outcomes of this study, I'm anticipating that by focusing on what's important to the individual nurse, as opposed to unit-based, focusing on the individual nurse and addressing what they value as far as health and wellness and what their goals are to get healthier and to feel better. I'm anticipating that these steps will reduce moral distress and burnout syndrome and lead to better scores on the MBI and the ProQOL at the end of the intervention. I'm also anticipating that the nurses will report an improved sense of well-being and maybe even an improved outlook at coming to work each day after the 8-week intervention. Some limitations to the study, maybe a nurse or two not being able to complete the study or have the time or resources to carry out the homework practices that were agreed upon in the sessions. I just want to thank you so much for your time, for listening to my proposal, and for helping me along my path to supporting nurses. So thank you so much and have a beautiful day.